Every second person is having some pain, some shoulder, back, knee, or some mysterious pain. Why is that? Why is it so common these days?
Lack of exercise, the lack of muscle structure in our bodies, that somehow is aggravating our joint disease.
If you notice that our ancestors, I think they were eating everything from chola bhaturas to all greasy food and whatnot.
Nowadays, we are stuck up with our mobiles, sitting in our office. We hardly have to travel by foot, and everywhere we go, we are using our cars and bikes. So,
So the best way is to go back to a simpler life. You specialize in robotic surgeries. Could you explain it to us? How does that go? How does the robo work?
Surgery is entirely done by the surgeon, and the robot is just like a tool. It's a tool to make the surgery more precise, more accurate.
Gym injuries, how common are they?
Most of the gym, the work is unsupervised, and sometimes the people get overzealous with exercise and
they overdo it. Hi viewers, today's topic for the podcast is bones, breaks and busy lives. And for that, we have a very special guest with us, Dr. Mohit Gupta. He's a very well-renowned orthopedic doctor from Punjab. He has a lot of international qualifications and he's done fellowships with European countries, one in Germany, one in Switzerland. He's helped thousands of people get back on their 2 feet. So, doctor, it's a pleasure to be talking to you today.
Thank you.
And I've been doing a lot of research on you and I have been impressed, nothing short of that. So, I would love to ask you, how did you start with your ortho journey? Was it this something you always wanted to do?
As you all know that my father is also a orthopedic surgeon. And he had made this setup about 45 years back in Malwa. This was one of the first orthopedic hospitals.
Yeah.
And I always wanted to follow the dream of following the footsteps of my father. So
you come from a family of doctors?
Yes.
So it was your natural instinct?
Yes. So after I obtained my MBBS, I followed for D-Orth. Then I went for residency. And after that, I went for MS. And after doing the MS, I did some fellowships. Some fellowships were done in India with arthroplasty. And then some fellowships I did in 2018 and then in 2019 also. So those were basically concentrated upon the knee and hip surgeries and the latest techniques on that. So I got exposed to the various aspects of the latest technology with regards to joint replacement surgery.
Sure.
And, that's how the things started.
Yes. So before we dive in further, I would love to ask a very basic question, like first things first. Like these days, when I interact with people, I think every second person is having some pain. Some shoulder, back, knee or some mysterious pain. Why is that? Why is it so common these days?
So I guess the most common reason is our lifestyle, which is becoming more and more sedentary. And the way we are doing things, the way we are eating, our protein intake, the lack of exercise, the lack of muscle structure in our bodies, that somehow is aggravating our joint disease. And that is why we are having more back pains and joint pains.
But if you notice that our ancestors, I think they were eating everything from chola bhaturas to all greasy food and whatnot. And these days it's all about avocado salads and kale and healthy things. So why is that?
So basically they were exerting themselves also, even if they were eating some kind of healthy fats or unhealthy fats, they were still doing the things themselves. Nowadays we are stuck up with our mobiles, sitting in our office. We hardly have to travel by foot anywhere, and everywhere we go, we are using our cars and bikes. So
So the
the
best way is to go back to a
yeah.
simpler life.
Yes. So I
Okay.
think even if we are accustomed to the indulgences of the
Yeah.
modern technology and the modern life, we still have to, go back to the exercise programs and start some kind of a habit for the general, the exercise of the
Yeah.
body.
Sure. And could you explain it to us? What is arthroscopy? And for our audience, if you could just tell it how you would explain to a 10-year-old to make it simple.
So I guess you are asking about arthroscopy or arthroplasty.
Both.
The- So both are entirely different things.
Okay.
So arthroscopy is basically a surgery in which we introduce a kind of a scope, which is a camera inside the joint. It's just like laparoscopic surgery, but a surgery done on a joint. So we do a small incision and we introduce a camera and a light source, and the entire surgery is done through that portal. So we don't have to cut open the entire joint. In arthroplasty, we basically change the entire surface of the joint. So we basically cut open the joint
Yeah.
entirely, and there's a big incision, and then we expose the joint. But in modern arthroplasty surgeries, we are now using robotics
Sure.
and other things in which the invasiveness of the surgery has become less.
Yeah. So you specialize in robotic surgeries.
Yeah,
I've come to know.
yeah.
So could you explain it to us? How does that go? How does the robo work? And like, do you need a real doctor when the robo is there?
Yeah, of course. The surgery is entirely done by the surgeon,
Yeah.
and the robot is just like a tool. It's a tool to make the surgery more precise, more accurate. So the surgeon uses the tool to perform the surgery, and the tool itself doesn't do the surgery by its own.
Okay. So
The
what if
robot is
a
not doing the surgery by independent
Okay.
of its own decisions.
Okay. Okay. But what if the robot needs a system update in between the surgery? Has it ever happened?
No,
I mean, I'm asking as a layman.
right.
Yeah.
So it doesn't happen like that because during the surgery, the parameters are already
Okay.
taken, the registration is already done by the surgeon. So the surgeon, basically, it's a computer. The surgeon feeds the data onto the computer of the robot, and the robot calculates the parameters,
So it is
tells the surgeon about the pathway he has to perform the surgery.
sure.
The surgeon can undergo the surgery in a way he feels like. If he feels like कि I have to cut the surfaces at 3 degrees, or he feels like I would like to go for a 20 degrees cut or something like that, he can do that.
Sure.
And the robot basically executes the plan which the surgeon has decided upon, and basically he does that precisely. So robot technology is being adopted worldwide, and in India it's becoming very prevalent. And most of the hospitals are now adopting
Yeah.
it.
So what about
Perform-
robotic surgeries? Are they very expensive that only the elite class can afford it, or it's not that expensive?
It's a bit on the higher side than normal surgery.
Okay.
But if you consider that the patient has to undertake the surgery for one time, and it's worth every money of that
Okay.
because
It's worth the money.
yes,
Health is wealth.
yeah,
Sure. And I also read that you were one of the very few first people who got the robotic surgery from Johnson and Johnson. You had got it. So could you tell us about that? How did that happen? How did you have that belief to get it so, before?
So basically, I was using Johnson implants. Basically, Johnson is uh, having a company known as DePi, and they are the manufacturers of orthopedic implants and orthopedic devices. So Johnson is basically just like a Reliance company or a umbrella group in which there are multiple other companies. So the orthopedic company is DePi, in which there are many orthopedic devices,
Sure.
and we were
One of the
using
first.
we were using those in Bathinda for
Yeah.
a very long time. And once they brought up this robot in 2023, I think 24. So I got interested in that. I had a demo and I underwent some training with that
Yeah.
also. And
I think you got it in Bhatinda even before big cities had it.
yes,
So how did you had that belief? कि ये,
so we were
it
one of the
would,
first in Punjab
yeah,
to
okay.
have the Johnson robot, orthopedic
Yeah,
robot.
which is great. It's a great achievement.
Yeah,
Yeah. So, okay, doctor, coming to gym injuries, how common are they?
they're pretty common actually.
Okay.
Yeah, they're pretty common because uh, most of the gym, the work is unsupervised, and
Yeah.
sometimes staff or the trainers are also
Not
unqualified,
present. Okay.
and it does happen because sometimes the people get overzealous
Yeah.
with exercise and they
They overdo
ignore,
it.
ignore certain things.
So, but who complains more of aches and pains? Is it the office going people with a desk job, or is it the gym going people?
It's more common with the office going people.
Okay.
I hardly
Because
see
sitting
people.
for too long is like slow poison for your body.
So sitting for too long strains your back, and virtually, the muscles of the back, they strain themselves and they atrophy
Yeah.
eventually because you're doing no exercise, you're sitting all day. So that puts the back on a
Too
chronic
much low.
strain.
Yeah. So it's becoming very common
It's very
these
common.
days.
Yes, it's very common.
So any exercise at the gym or any machine that you should totally avoid.
In the gym, I would say that once you turn up 40, you can avoid a treadmill because treadmill puts a lot of impact on the knees.
Knees, yeah.
And if you are not training in a stepwise manner, probably going for a deadlifts would be
Yeah.
avoided.
Yeah. Deadlifts do get, a lot
Yeah,
of injuries.
yeah. But
Sure.
if you're training well, you are doing the training under
Under
supervision and in a
supervision,
stepwise
then it's
manner,
great.
then you can do it. Yes.
Yeah. Sure. And any exercise to avoid squats? How about squats?
I would say that if your knee is damaged and there are some certain problems with the knee, then squatting would be avoided. And of course, there are many things like if you have shoulder injury, knee injury, ankle injury, everything needs to be reviewed by orthopedic surgeon.
Sure. So at the end of the day, gymming is great. You just got to be careful.
Yeah, gymming is great for the body because
Yeah.
you are building muscles and we are losing muscles as we age.
Age, yes.
And there are some stats which say that after the age of 30, we lose about 3% of our muscles every
Yeah.
10 years
Okay, after 30.
after 30.
Okay.
So we are losing muscles every year.
Yes.
So by incorporating exercise, weight training, we are building up the muscles which we are losing.
Yes.
And
So
it's
just
very beneficial.
be under supervision.
Yes.
Sure. And these days we're seeing a lot of knee replacement surgeries happening. Is it actually that much needed, or people are just hastily going for it?
So you're right in some way because patients do need knee replacement. Certain patients do need knee replacement, and certain patients are going for that before their time is, there that we can say that medically they are a good candidate for surgery. There are certain patients who come up early and they say that doctor, so and so our neighbor had surgery and we would also like to go for surgery. But orthopedically or medically, when we check the patients, those patients can delay this surgery by about 2-3 years. So we are seeing both kind of patients. Some patients are needing those surgeries and they are avoiding it, and there are other set of patients who would actually can delay the surgery, but they would like to go for surgery.
Okay.
So there are both kinds of people.
Sure. What is the most awkward or weird thing a patient ever asked you or told you?
Yeah, I remember a lady. She once told that my husband had undergone knee replacement surgery,
Okay.
and when we are walking, he walks too fast, and I lag behind him.
Oh, so
So
even she wanted.
I want a knee replacement now. Can you do it?
Oh, did you go
No,
ahead?
of course I didn't. Yeah.
Acha. Okay, this also happens.
Yeah, this happens a lot because patients are ill informed about the surgery,
Sure.
and they are not, knowledgeable about the things which you can do or you can't.
Yeah. Okay, so doctor, I would like to ask you, when is pain a red flag and when it's not? Like, I mean, something can be fixed with physio as well. You don't need to go for a surgery. Or how do you differentiate?
So when the pain becomes chronic and the patient is having regular pains and he has to take painkillers for that, and like for example the pain is continuing for about 6 months or 1 year or 2 years, then there is something going on with the joint,
Okay.
or the pain is very acute. There is a sharp pain. So those kind of things you have to look into, whether those injuries, there are some injuries with regards to sports injuries,
Yes.
or the joint is damaged, or there's something going on in the joint. So we have to
Sure.
see that.
So if it's prolonged and it's shooting,
Yeah.
then it's serious.
Yeah.
And you should address it.
Yes. But if it is just for 5 days, 10 days, it can be a normal, pain.
Which
And
can be subsided with
yes,
muscle relaxants.
yes,
And all.
by physio, by ice packs, it can go away.
But muscle relaxants are safe.
Muscle accidents are generally safe, but you do have to check with your doctor,
Sure.
because many people are having some kind of underlying kidney disease or heart disease, and you have to check with the doctor which kind of medicines you can take,
Sure.
because the muscle laxants are usually in combination with some painkillers.
Sure. Okay. Any message for the youth to keep their joints and bones safe?
So my message would be that exercise and diet are not just normal things. They are just like investment to your body. Just like you're investing in a stock exchange or mutual funds, you can just do these kind of exercises, muscle training, and diet. Protein diet is essentially. So those are essentially building up your body, and your body is just like backup, which will help you in old age.
You have to live in this पूरी life.
हाँ.
हाँ. पूरी life इसमें रहना है तो ध्यान रखो. तो क्या avoid करें?
अवॉइड तो
Junk
देखो,
food.
जंक फूड अवॉइड करें, डाइट अच्छी रखें.
हाँ. What is worse for your back? Is it like a long working hours or your some emotional baggage, your ex that also adds you to your back pain? Which is worse? Which pain is worse?
The pain of the axe may basically ache your heart, but
Acha.
it won't ache your back, I guess.
Okay.
Yeah. So I guess for your back you can still go for the exercise or
Yeah.
gym, or you can go to a physio, but for that you can't do anything.
Sure. Okay, doctor, before we end, I would love to do a rapid fire
Okay.
to make things a little light. So it'll be like quick answers. If not a doctor, then what?
Probably engineer.
Engineer. Okay. Nice. Okay. Morning walk or gymming
Gymming.
is better?
Yeah.
Okay.
I guess.
Coffee or green tea?
Coffee.
Coffee is better.
Yes.
Okay. Any food that ortho doctors love that is good for your bones?
I think eggs would be a good
Eggs.
choice. Yes.
Okay. Eggs is like a superfood.
Yes, it's a
Sure.
good protein. Yeah.
And calcium supplements, are they required or they're overhyped?
They're overhyped.
Okay. And any guilty pleasure of yours?
Yeah, chocolates.
Chocolates.
Yeah.
Wow, same. And which is the strongest bone in our body?
Strongest bone in the body, femur, thigh bone.
One thing patients should stop asking Google about their health. These days, people just go to Google the first thing.
I guess they shouldn't ask anything about their health.
Sure, because it just
Any-
creates
any health
anxiety.
disease, they shouldn't be asking Google,
Yeah.
because it confuses you a lot. particularly medicines. They shouldn't be asking about the side effects about any medicine,
Okay.
because if they ask the doctor, that would be much better.
Okay. So just don't go blindly by it.
Yes.
Okay. Okay. Your longest surgery ever done?
Um, there was one hip revision surgery,
Okay.
and it took me around 5-6 hours.
5-6 hours.
Yes.
Sure. In one surgery you love doing. You feel very rewarding करके मतलब.
I feel that hip replacements are very, challenging as well as very satisfying, because the patient is really into severe pain, and those patients are, really happy after the surgery.
So hip replacement, it gives
Yes.
you
Yes.
sense of satisfaction.
And the technical aspects of the surgery are, very satisfying for the surgeon. The placement of the cup and the stem, it's, you don't like to go give that surgery to any fellow or any resident. You like to
Yeah.
do it yourself.
One thing you're doing wrong at the gym, Dr. Mohit is going to tell us.
So lack of supervision and overdoing the exercise is, I think, bad for the gym.
Crackling of knuckles, is it good? Is it harmful or harmless?
It's harmless, totally harmless.
Totally harmless. Okay.
Yeah.
We can do to increase the life of our joints, bones, how to make it healthier?
So we can exercise, we can muscle train our body, use resistance or weight training, and eat lots of protein. I think that would be fine.
What is better for the bones, vitamin D or calcium?
Vitamin D is more important.
So, doctor, how to decide to whether go for a partial knee replacement or a total knee replacement?
So both partial and total knee replacement are good surgeries, but both are indicated for different sets of patients. If one area of your knee is damaged more, then you can go for a partial knee replacement. But if the entire knee joint is kind of damaged, then total knee replacement is much better option. Also, the partial knee replacement is more indicated for younger and thinner patients.
Doctor, robos make surgery safer?
So absolutely, robots make the surgery more precise. The results are more accurate, and hence they are more safer.
And the recovery is better with the robotic surgery?
Because we are not, removing the muscles while we are doing the surgery in robotic surgery. So we are not releasing the muscles.
Okay.
So the recovery is much faster in robotic surgery.
Sure. Any food you crave the most after a surgery? When you're done and you're like, oh, I did a
If I'm
great.
tired, I would, like a biryani.
Wow.
Chicken biryani would be
Great.
like, I would go up for that if I'm really tired and I'm hungry. Then
So you would use your hands or with spoon?
no, I use spoon and fork. Yeah.
Okay. So,
course.
and before surgery, what do you crave for?
Before surgery, you mean to say in the morning?
Matlab, any food or maybe chai, coffee before surgery, what you have?
I have a black coffee and a bowl of fruits, and sometimes a omelette or something.
Can you tell me any Bollywood or Hollywood, any celebrity whom you think has the best posture?
Posture, that would be very difficult because I don't observe the postures of
Okay.
the celebs.
But maybe Deepika Padukone, she has a great
maybe
poise.
Yeah, maybe.
Heels or flats?
I think sports shoes,
Okay. Sneakers or chappals?
sneakers.
Sneakers are better than chappals.
Yes,
Okay.
definitely.
Okay. And sitting cross-legged daily, is it okay or it's a red flag?
It's okay. It's okay. If your knees are okay, you are not having any arthritis. Sitting cross legs, squatting is all good.
Sure. Okay. And what is the best age to start weight training at the gym?
I think once you turn up 21, you can go.
Once you're an
for weight training.
adult.
Yeah.
Doctor, pillow or no pillow?
Pillow is better, I think, because there is some kind of curvature in your spine, and a small pillow or a curved pillow would be fine for your spine.
So, worst things we are doing for our spine.
Well, we are sitting longer than usual, and that is the worst thing, I guess.
Okay, so sitting too much.
Sitting too much, driving on a long distance without breaks would really
Really?
exert your spine.
So, what age group is the least that you've seen with the knee arthritis case? Your youngest patient?
So the youngest patient I have seen was around 38,
38.
and she had rheumatoid arthritis and her knees were totally damaged.
Was it a post-accident trauma? No.
No, she was having rheumatoid arthritis and her knees were totally damaged. Her hips were also gone, and she had earlier gone for hip replacements with me, and then she had knee replacement with me.
Okay. But losing weight helps lower the load on your muscles then.
So losing weight will help indirectly because it will reduce the pain and increase your mobility, but the arthritis still can't be reversed. But if you're developing early arthritis, losing weight would be a good idea because then you'll be delaying the impact of arthritis on your knee.
Yeah. And what about ACL tears? Do they ever fully recover, the patients, or no?
So ACL tears, if they're partial, they can recover and the knee can be absolutely fine. The patient can go around doing his things. But if it is a complete tear, most of the patients require a ACL reconstruction surgery, which is done by arthroscopic surgery.
But it can be fixed.
It can be fixed, yes, and the patients can go well back into their sports and everything. They'll be fine.
Okay, they can bounce back.
Yes, yes, absolutely.
Okay, I think that's a great message. People really get paranoid, if something like that
No,
happens.
no. Arthroscopic surgeries are really, advanced now, and we can have ACL repairs and PCL repairs and other repairs also. And even the shoulders can be fixed if there are some ligament injuries. And the patients are doing really well.
One surgical skill of yours that you brag about or you're very proud about?
I'm doing robotic knee replacement. In that, I'm using certain alternative strategies, which are kind of, these are known as kinematic knee replacement. I'm doing those, and I'm getting really good results with that.
Sure.
So that's a thing among arthroplasty colleagues which we brag about.
Okay.
Yeah,
It's another feather in your hat.
it's kind of a thing which we are doing right now, and it's giving us good results.
Okay, what do you listen to in the OT? Is it silent or you listen to some soothing music?
It's mostly silent, but sometimes the patients are afraid, and we play Gurbani or some.
Okay. So that gives them strength.
Yeah. So the patients like those.
Yeah, it must be scary, going for any surgery.
हाँ देखो सर्जरी कराने में डर तो लगता ही है.
Any common mistake patients make after surgery?
So the commonest mistake which I have seen is either they are too afraid to follow any exercise patterns, or they overdo it. It's the most common mistake. And once the pain is gone, they sometimes overdo the exercises, or they return back to their usual work very early.
Okay, they
which
don't.
we have reminded them कि इतनी जल्दी अपने काम पे नहीं जाना, but they still कई बार होता है कि आपको पता है कि मैं ठीक हो गया, and
So they take it for granted.
they take it for granted. So when they're coming up for follow-up, we reinforce those things again to the patients that you still don't have to go back to certain things. But yes, with the modern techniques, the patients are going back to their normal routine very quickly.
So resting is very important.
Rest is, of course, is very important for earlier 10-15 days. Yes.
Yeah. I think earlier there was a myth that, if you're resting, you're like wasting time. But I think our youth gets it now that rest and like slow life is sometimes it's needed to slow down.
नहीं, रेस्टिंग इम्पोर्टेंट है, ठहराव जरूरी है,
हाँ.
पर रेस्ट ना बॉडी वास्ते नहीं हो रहा है, माइंड वास्ते हो रहा है.
ਹਾਂ
ਰੈਸਟ ਆਪਾਂ ਨੂੰ ਜਿਹੜਾ ਚਾਹੀਦਾ ਨਾ, ਉਹ ਜਿਹੜਾ ਆਪਾਂ ਕਹਿੰਦੇ ਹਾਂ ਕਿ ਆਪਾਂ ਬਾਹਰ ਜਾ ਕੇ ਇੱਕ ਰਿਜ਼ੋਰਟ 'ਚ ਰੈਸਟ ਕਰਦੇ ਹਾਂ,
ਹਾਂ
that is more for the mind,
oh
not
for
for the
body
body.
no
The body, I think, needs more, adventure, more exercise,
acha more challenges
more challenges. You go around and you do certain things. You swim,
ਹਾਂ
you go sightseeing.
yeah
That is good for the body. ਰੈਸਟ ਤੁਸੀਂ ਜਿੰਨਾ ਮਰਜ਼ੀ ਕਰ ਲਓ, ਤੁਸੀਂ 4 ਘੰਟੇ ਸੋ ਜਾਓ, 10 ਘੰਟੇ ਸੋ ਜਾਓ, ਤੁਸੀਂ ਉਵੇਂ ਰਹੋਗੇ।
acha but mind body everything connected
ਯੈਸ, ਮਾइंड बॉडी इट्स कनेक्शन। पर अगर थोड़ा माइंड रेस्टेड नहीं है, you are agitated or you are not at peace, then नहीं है।
yeah sure okay and what about weather changes, do they affect joint pain?
So when it's colder, the climate is colder, then of course the joint pain increases.
More.
Yes.
So winters are brutal for people suffering.
People with arthritis, it's very tough
Okay.
in the winters.
Great, doctor. It was a pleasure
Thank
talking to you today. I hope you like talking to us as well.
Yeah, I enjoyed a lot.
Yeah. So this was Dr. Mohit Gupta for you. And as I told you, he's a very, very renowned ortho doctor in Punjab. And he's associated with Gupta Hospital. And we've mentioned his hospital and details. So thank you, doctor. Wish you all the best.
Thank you.
Thank you for taking out time for us.
Thank you.